Welcome to this training presented by the Leukemia and Lymphoma Society of Canada, titled Changing the Cancer Narrative, the Untapped Power of Cancer Health and Wellness Coaching. My name is Desiree Naylor, and I'm the Community Service Lead for the Prairies. And before we begin the main presentation, I would like to share with you our mission and highlight some useful resources. The LLC's mission is to cure blood cancers and improve the quality of life for those affected. We provide attentive, compassionate support, offering information specific to cancer type and treatment, and helping people manage their care and identify beneficial services. Visit bloodcancers.ca to find the community service lead in your area. We offer a continuing education program with over 40 self-paced training courses on blood cancer, treatments, and psychosocial aspects. Courses are expert-led, used by over 1,500 ACPs, and new content is added regularly. Here are some examples of what you can learn about: training on blood cancer, treatments, psychosocial aspects of cancer, etc. All of our expert vetted educational resources covering blood cancer types, treatments, and side effects are available online. We offer diverse multimedia formats, including digital booklets, fact sheets, podcasts, and videos to meet various needs. Use the handy electronic form on our website to order free printed materials like booklets, service posters, palm cards, and more. These will be sent directly to your cancer center or clinic. Most educational materials can also be downloaded instantly. Emotional and practical support is an LSC priority. Our peer support program matches newly diagnosed patients or those facing new treatment with trained volunteer survivors based on age, diagnosis, and treatment. This program helps build hope and alleviate anxiety. Additionally, we offer professionally facilitated virtual support groups from coast to coast, allowing the blood cancer community to connect, share coping methods, and break isolation from the comfort of their homes. It is now time to introduce our speaker today, Dr. Doris Howell. Dr. Doris Howell is a Canadian nurse scientist and academic known for her research in oncology nursing and psychology oncology. Her work has advanced understanding symptom management, palliative care, and the integration of patient-reported outcomes in cancer care. Over to you, Dr. Howell.
Hello, welcome everybody. It's such a pleasure to be able to give this talk today around changing the cancer narrative, the untapped power of cancer health and wellness coaching. So I'm Dr. Doris Howell. I'm a Mayo Clinic certified health and wellness coach and emeritus scientist at Princess Margaret Cancer Hospital. So it's great to have you today. And here are the learning objectives that I'm going to try and cover in this session. So at the end of this session, you will be able to describe health and wellness coaching and how we apply that to cancer populations, really understand the competencies required for effective health and wellness coaching, and of course, not only discuss the outcomes and benefits, but also how it's really applied in a couple of case situations in particular. But then how do we apply it really to foster not just management of the consequences of cancer treatment, but also how do we do that to enable both self-management thriving for our populations? So that's where we're going to go today. So it's great to have you with me. I think we all know too well what the cancer narrative and that we're talking about and what that looks like for people that we're working with blood cancers. Certainly the idea that there is, many biopsychosocial complications of cancer treatment. We hear time and time again, as do you, that sense of, who am I now? What's my new normal? How do I get back to my sense of self? Cancer changes everything. So we all know too well that narrative. And how can we actually shift that narrative to actually help people to restore health, to rehabilitate after cancer, and really return to that sense of self that they're hoping to get back to, which is not always a new normal. It's actually sometimes just a reconstitution of getting back to who they were before cancer and all that entailed for them in their daily life. It's clear when you look at this particular slide and some of the things that we know from the literature that there is limitations in terms of our current survivorship medical paradigm, which tends to focus on surveillance, Certainly, interventions around multidisciplinary care can certainly be available in survivorship programs, but we're actually failing when it comes to behavior change and really fostering and facilitating people's ability to recover and restore health and restore a sense of meaning and purpose and value in their life, the things that really get them up in the morning. So if you look at this slide, you can kind of see that we are, if we focus on information only, that people only retain 20% of information, 40% to 80% of the information there is forgotten shortly after they're told. The adherence to multiple healthy behaviors is extremely low, both in the short term as well as in the long term. And you can see that on the right-hand side of the slide, that it ranges from 31% to later health behaviors of less than 25%. We know that there's the multiple consequences of cancer treatment that I've already spoken to. And what we hear time and time again from survivors, that they lack a roadmap and the tools and strategies that they can put in place to recover their health. They feel vulnerable and lacking in the confidence to create a new pathway forward so often after they finish treatment. It's only the beginning of a new journey for them and how to figure that out. So we do know that, of course, they also describe some of the shortcomings of current healthcare and delivery, which is focused on that medical paradigm. So, I saw about 15 health professionals, and no one asked me about how I was coping, yet I was on the edge. Suboptimal medication adherence is a problem in chronic myeloid leukemia patients. People dread sometimes going to clinics after cancer treatment because they're being told they must take action on their health. They must adopt healthy lifestyle behaviors, but often feel that they're being reprimanded for not taking action, since they know and we know the health risks by not taking action that will translate into potential, shorter term survival and not the best health outcomes. And then, of course, some patients even described that they felt shamed about not taking action on their health, especially around areas such as weight gain that can be common for many people going through cancer treatment and after cancer treatment. So let's start with a little bit of a story, just so that it really starts to make sense for you about what we're talking about and why do we really need to sort of shift our paradigm and thinking towards how do we actually provide coaching to individuals and clients who are going through recovery of cancer treatment in that post-treatment survivorship period. And of course, all of this needs to start very early in the cancer continuum, but I'll particularly focus on the after treatment and survivorship phase of cancer care in the continuum. So Anna's story is she's just a young, an AYA. She's young. She's 25 years old. She's gone through cancer treatment, typical ABVD treatment for Hodgkin's disease and mantle radiation therapy. She's overwhelmed with her fatigue. She's coming in to see the clinic for her 3-month surveillance appointment. She has a very busy schedule, working part-time. She's also in school as a kinesiology student, so kind of a very typical 25-year-old. She tells you she's resting all the time. She's stopped her regular physical activity because she's just too tired. She has numbness and tingling in her feet, and her doctor has told her, you must take action. You had better get back to healthy lifestyle behavior because you're high risk for not only the cancer returning, but also cardiac disease. So you can imagine what that feels like when you're facing all of these symptoms and side effects of whatever treatment exposure you've experienced. And at the same time, being asked to take action on your health, but how do I move forward? What does this need to look like for Anna? And where does health coaching potentially come in as a support system for Anna in this situation? So, of course, she does go on to complain the fatigue is overwhelming. It's interfering with her social life and activities, such an important domain and dimension of who we are as individuals. And she's tried to get out running again. In fact, she thought that, can't I just go back to my regular running schedule? Because running was something that she really valued, and it was part of how she valued health and getting back to being healthy again. But she didn't really know how to do that. She wasn't really directed in that from her healthcare providers. And so she was caught up in this vicious cycle of fatigue that is so typical of what we see with cancer fatigue, that she tried running and then ended up paying for that by actually having to rest for a few days and really being able to function very effectively after trying this out and trying to get back to her regular running schedule. And of course, now she's kind of feeling pretty defeated. So maybe, not only am I feeling quite defeated and frustrated that I can't get back to my running, which was so important to me, but this might actually be a sign that the cancer's coming back and very fearful of the cancer returning. So also dealing with fear of recurrence is part of her experience. I'm going to come back to Anna, but I really want to leave you with, here's the kind of scenario that is really important for us to think about. How do we apply cancer coaching, cancer health and wellness coaching in this situation? So I'm going to come back to Anna, but I want us to have that first and foremost in our mind, the struggle that can occur as people try to recover their health after cancer treatment. And what we do know is that simply giving information to patients, so advising, as you saw the doctor did in Anna's situation, is unlikely to change their behavior. So the healthcare providers really must understand the psychological principles that underlie self-management training, and also understand that comprehend that motivating patients requires more than imparting brief information to the patient. So patient education is important, but it is inadequate to change behavior. And the evidence is pretty strong and compelling in relation to what I've just shared on this particular slide. So it means that we really need to think about three fundamental shifts if we're really going to support people's recovery and post-treatment survivorship. And that means the first shift we have to make, that we have to start to view patients as experts with the knowledge and capability as partners in co-creation of health. We also need to shift from patient education to focus on self-management support and coaching for behavior change, which is not the simple passive sharing of information that I spoke about in the earlier slide. And shift three, we need to think beyond just the medical management of consequences of cancer treatment to start to really shift towards how do we help people to focus on wellness, thriving, and flourishing. The things, as I say, get us up in the morning, the things that give us meaning and purpose in life. So before I kind of get into that in a bit more detail, and particularly shift to sort of the idea of coaching and where does it come in, I want you to have a clear understanding of what is self-management and self-management support. There are so many different definitions out there in the literature, and often different terms such as self-care are used interchangeably with self-management and self-management support, and they are not the same thing. Self-care is what you and I do every day to sort of manage health and to keep ourselves well and healthy. But self-management has a particular definition that it is about the tasks that an individual has to undertake to live well with one or more chronic conditions. And these tasks, which I'll elaborate in a moment, are around gaining the confidence to deal with medical management, role management, and emotional management of any particular chronic illness. And we know the challenge with cancer is it's a very dynamic illness, that there can be acute situations or acute consequences at the same time a person can be dealing with this illness in terms of a chronic condition additionally. And that makes it very challenging, and why we need to think about self-management support and health coaching together as a delivery approach. So self-management support is defined as the systematic, and I want you to just pay attention to that word, systematic provision of education and supportive interventions by healthcare staff to, again, increase the person's self-efficacy, their confidence, their skills in managing health problems. And it also includes very specific components of regular assessment of progress and problems, goal setting, and of course, problem-solving support, which I'll elaborate in the next few slides. So just to reiterate, the components of self-management support entail all the issues of medical management, making sure that they're really skilled around very specific strategies, not only to manage the things you heard in the first slide about adherence to medications, adherence to medication and treatment regimes that could be ongoing, how to actually recognize symptoms and when one is into trouble in terms of disease recurrence. You can see Anna doesn't know how to differentiate between, is this fatigue ongoing because I actually have recurrence happening? Does she actually know how to monitor for signs of reoccurrence? Does she actually understand the difference? Have we really guided her with that? Role management, of course, is, we work hard to recover return to work, the activities and tasks involved in carrying out usual roles, while trying to figure out how do you do that to accommodate your illness. So when people think about returning to work, how do they ensure that they have accommodations for ongoing consequences and symptoms? How do they actually manage their energy in a day? How do they actually do that effectively? And that's a huge challenge. And then, of course, emotional management. We know that there is a wide range of emotions, sometimes mental health issues that can occur for people going through cancer and cancer treatment. And emotional management requires not only recognizing of this, but having really effective stress management skills, coping skills, and of course, being able to know how to and when to seek mental health support. So that sounds like a very simplified view of thinking about self-management. When you look at this diagram, these are the myriad of tasks that are really essential for effective cancer self-management. And they fall within these four domain areas. So self-management of the illness-related demands, which is that medical management I spoke to a moment ago, but these are sort of the specificity of those things under this particular domain. And it could include something such as managing multimorbidity, because we know people who, depending on their treatment exposures, may have more comorbid disease that develops, and they're managing many different chronic aspects of having cancer treatment and not just their original cancer illness, and all the other things I've talked about already in this particular box. Again, self-management of psychosocial consequences, we've talked about that, but I want to just make sure it's added in there, is this whole idea of the social relationships, renewal of social relationships, and of course, sexual health challenges that can occur for any cancer population. It doesn't have to be a population that's particularly affected in terms of treatment of focus on sexual organs or sexual functioning changes. It's the overall idea of sexual health that can be impacted. It means that we need to think about health promotion. As Anna's doctor heard, you're at high risk potentially for metabolic syndrome. You're high risk for cancer recurrence. You need to take action on the health. But we recognize and know that this isn't action on just physical activity. It's more than that. These are multiple behaviors that are necessary to reduce the health risk of cancer coming back, the cardiac disease, and any of those other late consequences that can be part and parcel of post-cancer treatment and survivorship. And then, of course, figuring out how to navigate often siloed healthcare systems, often siloed survivorship systems. Now with my family physician, am I still with my multidisciplinary oncology team? What does that need to look like? And then how do I think about returning to work and making decisions as I go forward into this period of post-treatment survivorship? It also means for effective self-management that we have to think about there's key core skills that are essential. So not only do we teach people those very specific evidence-based self-management strategies to manage a problem such as cancer fatigue or cancer pain, such as the peripheral neuropathy side effects that can occur. Those require very specific self-management strategies, and those are evidence-based or need to be evidence-based. But we also teach them skills that are essential for managing cancers or chronic disease, and that includes things like problem solving, how to actually make decisions using a problem-solving process, how to make decisions that are really valuable, important for the person. And those decisions could be related to the health behavior that they're going to actually enact, but it might also be around treatment decision-making and ongoing treatment decision-making related to medical management. Being able to really being astute and effective at self-monitoring, as I said, recognition and understanding, the signs and symptoms and how to adjust behavior. So for instance, as an example of that, Anna has just been, challenged by going back out to running, experienced significant and severe cancer fatigue. Part of our approach to help her with that around self-monitoring of disease and symptoms would be able to help her understand what kind of level of fatigue are we hoping that she can, tolerate, and then how can she work back up her running schedule so she's not exacerbating very severe fatigue. But that means we really need to work closely with her as to what to watch for, how to monitor her behavior, and how does she adjust her daily behavior to ensure that she's not overexerting herself and able to figure out this sort of delicate sweet spot between running again and moving forward with a set of actions to actually build and make progress in her physical activity, but also not doing too much that she continues to be caught up in this vicious cycle that you heard me talk about she's in at the moment. Setting goals and action planning is fundamental. We know the evidence is very clear on that for self-management support. But there is a fine art to that. I'm not going to be able to get into that today, but I wanted to just make sure that you're clear about that. And then, of course, partnering with healthcare providers and being able to reduce risks as well related to health challenges that the person's experiencing. So that means that shift that I spoke about earlier, we need to shift from this expert approach that is telling people what to do, solving their problems, making assumptions that they actually know how to take steps forward when they've been through cancer treatment. And in Anna's situation, you can see she's really struggling. What are the steps? How do I build back up? How do I ensure I'm actually making progress in building my physical activity back to where it should be and what we know the evidence suggests it should be in terms of 150 minutes of intense exercise weekly? And it means we shift to a coach approach. And I've sort of alluded to this already, so I won't spend too much on this time on this slide because I want to make sure we get to the whole conversation we're going to have today. But moving towards a coach approach, which is about facilitating behavior change. It's really eliciting from the client what's most important to them, what matters to them, how to move forward in their life post-cancer treatment, and what area of focus that they may want to move forward with in this particular context. And of course, recognizing that it's ultimately the client's responsible for their health, and we need to foster their possibilities that they can do this, they can manage it, but give them that coaching and capability and capacity for doing that from a self-management perspective. It means that we need to understand the client's story, and we as coaches, clients work very hard and are working harder than coaches and experts in this situation because they're trying to figure it out. And we actually dance with the client. It's very different than advising, providing us as experts to them and what they should do. So when you think about these ideas that I'm bringing forth, well, boy, and you think about Anna's situation, we sure could all use a health coach, but particularly when we're talking about post-treatment survivorship and all of the consequences from a biopsychosocial perspective and all of the health behaviors that need to be enacted to actually be able to promote wellness and to be able to actually reduce health risks as a person moves forward into that sort of period of survivorship. So we need to think about that when we talk about self-management, it's a little bit more than that. And we would suggest strongly that both self-management support needs to be combined with health coaching. And I'm going to share with you now a little bit more what is the specifics of health coaching that are critically important if we really want to see behavior change and restoration of health and meeting of some important health outcomes that we'll allude to a little bit later. So we're on the same page and making sure that you're on the same page as me in terms of understanding what is health and wellness coaching. So the National Board for Health and Wellness Coaching has defined it as a client-led partnership process. So it sort of links back to what I said earlier around, shifting from this expert role to actually partnering with clients around co-creation of health. And it's really focused on empowering individuals to make self-directed, lasting health behavior change to improve their overall well-being. And it does require that coaches can facilitate client discovery, goal setting, action planning, and provide motivational support to enhance health through those multiple healthy lifestyle changes that may be essential and fundamental to restoration of health post-cancer treatment. But at the same time, recognizing that the person themselves has strengths and often have solutions around how to actually work forward and move forward as they rebuild their life after cancer treatment. There's lots of cinnamons out there, but basically it is focused on self-management and resilience, but it's focused on much more than that, and I'll share that in a moment. When we think about cancer coaching, just to highlight a couple of things from this. So again, it is person-centered, it's collaborative, it's done in partnership with the client, and we see the person is the expert on their own illness and they're expert on their own life and what the path could look like moving forward. We work collaboratively to decide what that path is and help them to get there in cancer coaching. And of course, it is, everything we're doing around this is to promote self-management and resilience, but it's also, everything is about a coaching approach. So we sort of think about, collaboration and partnership, empathy and acceptance, and all the really important elements that are part of a coaching approach. And then, of course, motivating, as the third one says here, motivating self-determined behavior change through that supportive relationship. And we really emphasize theoretical underpinnings of self-efficacy theory, building their capacity, again, around all the things that are part and parcel of self-management, but also part and parcel of how they actually move forward with health behavior change. And again, we build on strengths. So these are all of the areas that cancer coaches may focus on for supporting that sustainable life changes and health practices. So eating well, managing weight, smoking cessation, really supporting coping with stress, feelings of fear. So you heard Anna talk about the feelings of fear of recurrence. I also coach with a lot of people who have progressive advanced cancer as a chronic illness. And so how do you live with that fear that at any point in time your disease could come back? So it's not just fear of recurrence, but fear of disease progression, and addressing that feeling of overwhelm and dread, and how does one learn to cope effectively with that, and still hopefully have, focus on life that just isn't about, oh my God, my disease is going to come back, and what that looks like for this individual. Healthy sleep, of course, moving more. Symptom self-management is part of it, of course, because there are those long-term consequences in post-treatment survivorship. And then a real focus on the dimensions of wellness, all the dimensions of wellness for whole person health. And I'm going to come back and talk a little bit about that more in a few moments. Rebuilding relationships. We hear time and time again as part of the cancer narrative that people talk about they have not been able to reconstitute some of their relationships and connections with people. They've sometimes become isolated because they're not sure how to move forward, but also that they just have lost a lot of the connections. How do they rebuild those kinds of things? In addition, family caregivers can be so overwhelmed with what the experience has been like for them. It may be very difficult to have those conversations around how do we, have open conversation and talk about what's happening and what the future's looking like. And so often people going through cancer will hear, why aren't you better now? It's 3 months. Anna's probably hearing, it's 3 months since treatment. Why haven't you recovered from your fatigue? Why aren't you able to just get back to the way you were? So often there's that lack of understanding between friends, families, and the person who's going through this experience. And then ultimately, we really focus on how do we reconstitute thriving and flourishing in this situation. It's really important that everybody understands when we're talking not only about those self-management skill sets around the core skill sets and how do you do that effectively. Those are specific tools and techniques that we teach health coaches who are working in the self-management space to work with. It also means that cancer health and wellness coaches have a lot of skill sets that they apply to working with individuals going through this type of health change to be able to restore, and change that cancer narrative. So as I said earlier, they're building on theories from health psychology, behavior change, and they apply a whole host of theoretical underpinnings and skills and techniques that are tied to that, that we know are essential for helping the individual and to address all of those dimensions and domains I just spoke about in particular. So there's a clear upskilling that is required for healthcare professionals to do this well and to do it in such a way that it translates into better health outcomes. And so the second bullet and picture on this circle is of course, the experience, knowledge, and skills of a health practitioner. But listening skills, problem solving skills, empathy, everything what one needs to do to actually have active listening, deep listening of individuals, really being able to build that rapport and that collaboration that I spoke about earlier. And then on the right hand side, the skills and techniques that we derive from developmental and performance coaching, but goal setting, effective questioning. We call that powerful questioning that gives insight to the individual as to how they can move forward and what are the possibilities from their perspective. Really understanding their vision in terms of what this reconstitution of their sense of self after cancer treatment looks like. We ask powerful questions to provide them with that insight. So that vision can compel them forward around the health behavior changes that we're fostering and facilitating and working with them around. And how do they address setbacks that are going to kind of be natural as you move forward in this direction. We do sometimes use a very structured approach. I'm not going to spend a lot of time on this. Certainly, I'm assuming you'll have access to the slides after the presentation. But we do structure the approach. It's sort of not just, free for all. It clearly has a structure. Coaching has a structure. And we use different structures, motivational interviewing structure, but we often use what's called the 5A's model. And the reason I put this one in the slide in particular is across Canada, there is a lot of toolkits for family physicians around and nurses and other interprofessional providers as to how to use a 5A structured coaching approach to counsel individuals for behavior change. So it starts really first with getting to know the person in the ask phase, really working towards engaging them around a priority area for health change. And it might be very direct to talk about, what has it been like for you after cancer treatment around physical activity, and very specific questions around that assessment engagement process. We ask, are they ready to make changes around, these multiple healthy lifestyle behaviors that are critical and essential for reducing health risks? Then we need to set up priorities. Is the priority around exercise and physical activity? Is the priority around healthy eating? All of those will come into play in a whole coaching plan, but there's a specific place to start around what matters to the person. And then, of course, agreeing on a change plan, and that requires all the things I've talked about already before: goal setting, setting actions, very specific actions, and helping the person to guide and decide how will they know they've been successful in making progress. So somebody like Anna really needs to know that she needs to start low, go slow. We would actually use something to share information with her with permission, to actually build on what she already knows and then facilitate talking about change and steps she can take to move forward with that. But we would draw those solutions from her. She's in kinesiology. She probably knows you need to start low and go slow, but you forget about that when you've been through a cancer diagnosis. And so we would ask a powerful question like, what would you tell a client that you're coaching in kinesiology around how to get started on moving forward with a physical activity plan? What would that look like? They generate the solution. And then problem solving any obstacles that occur when they're not feeling confident about moving forward on the action plan. And of course, really moving forward to give them the support and systems they might need. If there's peer support or other organizations that can help them to move forward, we make those arrangements additionally. So when we do those things effectively, both really focus on the self-management core skills and the self-management strategies that I spoke to earlier, and the evidence that we know those are the specific strategies that need to be enacted by the client, then we also know that alongside health coaching does translate into improved health outcomes around reduction in symptoms, reduced emotional distress, certainly reduction in morbidity and mortality related to things like metabolic syndrome. Reduce risk of cancer recurrence. We know that also if people adopt multiple healthy lifestyle behavior change post-treatment. And of course, it translates into reduced health costs. So while there may be a cost for having a health and wellness coach in your clinic, it means it also will be hopefully offset by the reduction in emergency department visits and other issues that can occur by doing this well. So you're offsetting those costs. So it does mean, it's more than that. So it's more than that healthy lifestyle behavior change. As I said earlier, coaches really work towards a wellness thinking, looking at the domains, the multiple domains of wellness, and how to work with individuals around what is the recovery and restoration of health look like from a wellness perspective as well. So it's beyond surveillance and typical survivorship models that tend to focus on surveillance and treating and curing illness, and it's episodic, but it's actually focused more on how do we proactively support an optimal state of well-being and actually help people to not only promote health, but actually move towards and integrate into their life a new vision for their health and where they might want to go to thrive. So let me give you one more story, and I'm going to come back if I can to both Anna and to this particular individual. So Nigel's story, he's an older male who went through stem cell transplant, so you can kind of understand the kind of post-traumatic emotions that can kind of go along with that recovery after cancer treatment. He's single, so he's got all the challenges of being a single father. He's got 2 teenage children and all that challenge that creates in terms of working with a wife who's not in the picture and not a supportive environment around other people that are in his life. So he's really overwhelmed with his emotions, not sleeping, doesn't know how to sort of deal with, how do I move forward? Should I even take these antidepressants? I think if I just got stronger, and could manage these emotions, that I would then get better and I wouldn't feel so overwhelmed and, how horrible this is to deal with these emotions. And maybe I should have taken time off work, but he's trying to make a decision about that. So in a situation like Nigel, we would be helping him back to that first diagram. We would help him to make decisions about whether he should take time off work or not take time off work. And we'd be using a problem solving and a decision balance scale, which looks at pros and cons around some of those kinds of areas. In addition, we would be using an ask, tell, ask to talk about sharing information with him about the benefits of antidepressants, but also that there are other things that he can do to take action on his health. So we wouldn't just focus on the expert kind of thinking that, he's got to take his medications, we've got to get adherence here, but why is he not taking his medications? And that there are other options in addition to antidepressants and that would actually help him to recover his emotions, perhaps. We know that physical activity can help with that, as well as there's all kinds of other coping support that a coach would focus on with somebody like Nigel to help him to work that through. We would share information in a very specific permission type way around antidepressants, and then really get his thoughts and ideas and brainstorm with him around strategies that might work for better coping, that might work for managing the emotions, and for hopefully reducing, the feeling that I'm just not strong. So that means that we start to focus more on not just surviving, all of those things I talked about earlier, really focused on certainly, optimizing longevity and surviving in post-cancer treatment populations. But now we need to also think about how do we help people to thrive and flourish, and health coaching has a really important role in this particular space as well. So this is the definitions, a little bit of the definitions in that direction. So surviving can just be thought about of continuing to just exist or, live. But it's, we know that in order to change that cancer narrative, we need to start to think about that it is, living is about more than the mere purpose of staying alive. It's about pursuing goals, but it's also bringing joy, sense of purpose, sense of meaning back into our life, not being in miserable relationships, restoring and reconstituting relationships. And flourishing is really about attaining a satisfying existence and feeling like life is worth living. And so it might focus on daily tasks. It might focus on coping in terms of the coaching conversation, being able to work on that person's strength and mobilizing those strengths for them to take action and move forward in goal setting. And we know from people with cancer, if you look at the multiple texts that are sort of out and available around, this is an area that people with cancer want to pursue. How do I thrive after cancer? You can see the focus of the textbooks that are out there. They don't want to just survive. They really want to figure out how to actually thrive after cancer. And so often those conversations come up in health coaching around, how do I actually really move forward to, restore wellness, well-being, a sense of joy and purpose in my life. That's also where they want coaching and help with to really change that cancer narrative. So coaches create pathways to hope and thriving. And this is just a picture so you have it. There was at the Ottawa Foundation. They had for many, many years offered people with cancer, after cancer treatment, 5 sessions of coaching. And there's lots of literature out there and some interviews around how they actually did that. But boy, was it sure valued around how they actually created pathways to hope and healing. And so we use another framework that really helps us as coaches to work in this direction called the PERMA. And this has been developed by Seligman, who has had a strong focus in positive psychology, that we need to shift our psychological thinking around, how do we correct negative emotions from people who are going through cancer experience? How do we actually focus on positive emotions? And so these are the areas of the focus of PERMA modeling coaching, that we think about the person's strengths. How can we leverage those strengths, as I said earlier? How do we bring positive emotions back into the situation, restoring relationships, restoring meaning and accomplishment, and of course, dealing with all the issues of health challenges that also have to be addressed as part of that. How do people move more, sleep well, manage stress better? All of that is part of thriving. And so all of our coaching conversations will perhaps focus on these. And we've talked about facilitating behavior change related to these particular areas. And so when we're talking about positive emotions, we're talking about all the range of positive emotions. There's about 10 positive emotions that we need to be thinking about. That's joy, gratitude, you know, um, just feeling a sense of purpose and meaning. So there are so many different positive emotions. It's not the same as the positivity. So it is positivity, but it's not the positivity that we think about, that we often hear clients, our people with cancer telling us, everybody's saying, just be positive. If you just be positive, you'll get well again. Everything will be fine. And there's nothing more annoying for a person with lived experience who's hearing that. We're not talking about that type of positivity. We're talking about very strategic help and support to bring positive emotions back into life. Varney has said, another author, not Rebecca Newton, but Varney has said, so often we've lost joy when we go through this type of serious illness. We forgot how to reconstitute joy in our life and what that can look like, because sometimes the fear can be overwhelming. The fact that we're trying to get back to this sense of self and who we were before. And people talk about this new normal. Maybe it's not so much a new normal. We've heard that so often from people with cancer, that it's actually, no, I want to get back to who I was, my authentic self, my sense of self. So he suggests that in fact, depression, adult depression and distress that we might see in cancer survivors as well as other populations is because we forgot how to reconstitute joy. So that's why coaching does also focus in and facilitate behavior change around using the mind. How do we bring in these positive emotions back into our life? And there is actually evidence, which I'm going to share with you in a moment. So what we do know, that from somebody called Fredrickson in the broaden and build theory of positive emotions, she's done a significant amount of extensive research around this idea of positive emotions, and that if we actually put into our day small intentional actions that inject these positive emotions, it helps us to take control of our well-being on a moment-to-moment basis. And there's actually clear evidence that it has a health outcome of reducing distress, reducing depression, and I'll share a little bit more about that in a second. So little moments of joy throughout the day can add up to greater physical and mental well-being. So often we use a wellness framework and work with individuals in health coaching to discover and uncover where do they want to think about, what does their wellness look like, what's their vision for wellness, and how do we bring positive emotions as one of the dimensions of a wellness wheel or a wellness framework back into their life. What might that look like? What is the possibility for them? Hearing that powerful question again that I said earlier. So we do not ignore, of course, the negative or challenging aspects of dealing with a cancer diagnosis and recovering from cancer, but we also think about how can a person increase the ratio of positive emotions to create this upward spiral of positivity that we know has mental health benefits. And it's interesting when you look at the research. So what you see here is a research study of a very rigorous randomized controlled trial that clearly showed that using your mind and positive emotions that are generated so often when we use mindfulness and meditation and these other kinds of strategies and tools, that in fact it is more powerful than medicine for persons with anxiety disorders. So people who actually practice mindfulness-based stress reduction and meditation actually had better reduction in so mindfulness-based stress response reaction training worked about the same as medicine to reduce anxiety symptoms. So really important areas that we can pursue in health coaching and do that. In addition, there's a lot of emerging evidence around gratitude. So gratitude in a systematic review and meta-analysis has been clearly shown that it does shield from negativity, can promote happiness, but we tend not to focus so much on happiness when we're talking about using something like the PERMA model in health and wellness coaching. We think about happiness for sure, but we really focus on thriving and flourishing and what does that look like and what is the vision the individual has for that. And so gratitude has been shown that it actually, we know that there is something called neuroplasticity now that our brain can actually create new pathways to health and new pathways to healing. Gratitude is one of those things that help us to recognize that there is this neuroplasticity in our brain, and we can create these new pathways even when we think it's just not possible. I'm just the way I am. We can actually work with them around that. And there's science around this. And so eliminating stress, improving sleep, these are all the outcomes from something like a gratitude practice. And it doesn't mean, again, we advise people, oh, you should try out gratitude, try out journaling. We do that in the context of their vision and what are the possibilities for them. We use powerful questions to ask things like, what are your thoughts about a gratitude practice? We don't advise these things. We look for and work with the person to find the solutions and the strengths within themselves around these particular areas. And of course, these are all the acronyms in the PERMA model. So again, back to thinking about relationships and connection. And I said cancer health and wellness coaches really focus on this area. We know clearly for a long period of time that the evidence is very, very clear that isolation is very damaging to one's health. We do know that loneliness is a key indicator of poor mortality outcomes. And we also know that connection, relationships are part of building resilience, and that those are critical for people to actually be able to thrive and flourish. Social support has long been known as a buffer for depression and a buffer for high levels of emotional distress. So that's really important that we know it. Even in my own studies, we showed that women with high levels of self-efficacy didn't have the same level of depression as those who had very low levels of confidence and self-efficacy around how to manage their cancer and recover from cancer. And then finally, this whole area of purpose in life has been shown as a predictor of mortality across adulthood. And this was in a general population controlling for everything. They clearly showed that purpose in life and meaning in life is so important in terms of longevity and how one can recover from mental health distress, physical illness, and manage chronic illness, of course. So just to wrap up, I've shared a lot of information around what is it that we do in terms of both fostering self-management support and the kind of skill sets that that requires and how to do that and how do you work that step forward. So let me come back for a moment to talk a little bit about, before I do this final summary, um, that I want to come back a moment to Anna. So in Anna's situation, with Anna's scenario around this fatigue and trying to manage and get back and recover and not really sure how to take action on moving forward with physical activity. And yet the coach explores with her, in fact, that running has been the thing that gives her joy in her life. But she can't go back to the same level of, 5 miles a day and trying to reach this idea of a potential, 3-mile marathon in the future. We need to help draw on her strength as to how do we go slow, start low, go slow, and how to build that up and show progress over time in the coaching with her around facilitating effective behavior change around adopting physical activity. But also, you heard the reconstituting of relationships was important for her. So everything I'm sharing with you around this approach towards wellness and well-being in the PERMA model as a particular skill and strategy, again, that can be used in cancer coaching to really support thriving and flourishing, so that someone in her young life, such as Anna at the age of 25, that we really can work towards that. How does she get back to her sense of self, who she was? And then, of course, for Nathan's situation is being able to give him the coping tools, the powerful coping tools. How does he actually enact, what happens with people who are dealing with chronic cancer is the coping skills become exhausted. They don't work anymore. They're often the same skills that people have tried over and over again. They don't work anymore. They need new coping skills and need to be able to apply them, see how they're successful, and that's where goal setting and action planning comes in from a health and wellness coaching perspective. So just to summarize and bring it kind of all to a close in terms of this conversation in this session of teaching, is that cancer coaching is, again, that powerful tool that we can use to help clients to restore health and well-being, develop resilience. It's also a way to sort through in a very positive way the overwhelming amount of health information that people are given. When we do an ask, tell, ask, and we ask, what do you know already about something like metabolic syndrome? Then we build on that knowledge, and then we end with, so we do the telling, but we also end with asking, what are your thoughts about that now? What does that mean for you in terms of behaviors that you're trying to move forward with and as part of your recovery? It's strength-based. It's equally powerful, as I hope I've demonstrated you, for managing emotional distress and fostering flourishing and thriving. And it does focus on the whole person. It's not just focused on the physical and surveillance, as so often our survivorship programs do, but it's really focused on all these other areas that I've alluded to. So I leave you with a bit of a powerful quote around cancer coaching. As I said, involves all of these techniques that is on this slide: deep listening, powerful questioning, a structured coaching conversation to facilitate health behavior change. And it is about using very specific skills and techniques such as motivational interviewing and all the skills that come from what we understand about positive emotions and positive psychology, self-efficacy, and building person's confidence, and really helping them to develop their own toolkit and strategies that they can move forward with from there. And it is, summarized by Margaret Morris, supporting the client as they carve away life's clutter to reveal their best selves. I love the quote by Michelangelo when he was once asked how he went about the sculpting process, and his answer was, "I saw the angel in the marble and carved until I set him free." In many ways, this is the art and power of coaching. We really work towards helping that person to identify their vision, their idea of their best self, and then facilitate and work alongside them in collaboration and partnership to achieve that vision of where they want to go. So I end you with this particular quote by a client who went through coaching. So my health coach has given me a life jacket. My coach, like the life jacket, kept my head above this uncertainty and sometimes murky waters of cancer. Doctors work diligently to save our bodies. My health coach works diligently to save our lives. She is giving us the tools to not just live in cancer, but to thrive through cancer. So I think that kind of sums up, all of the things that I've hopefully been sharing with you, and as part of this teaching and training around the power of health coaching. And what's particularly, just to sort of wrap up, is with all other chronic diseases, we've recognized that we need to mobilize and deploy health and wellness coaches. And so places like the Mayo Clinic have those health and wellness coaches in their clinics. But for some reason, cancer lags in this direction. And we often, I think, make assumptions that people can just figure out how to move forward. And that's not the case. And if we're going to change the cancer narrative, we need to start to think about how can we integrate health and wellness coaching in cancer survivorship, service delivery, and health service delivery. Thank you so much. I'm just going to move this next slide towards, there's my thank you. So I thank you so much for being with me in this presentation.
Thank you so much, Dr. Howell, for this presentation. To you who are listening to us, I hope you enjoyed it. We invite you to access the continuing education platform to view the other training courses. This event was made possible thanks to the support of AbbVie and Novartis. And finally, I would like to remind everyone that we are here for the blood cancer community. Do not hesitate to order our tear pad for free and to contact us if you need more information or support. Have a wonderful rest of your day.